Wow. Yeah. What did you think when you were going through all the functional medicine training in comparison to all that you've been taught? Because you have a PhD as well.
Yeah. So it's the upside down show, right? I mean, I don't know your entire background, but I can imagine that you at some point had to experience this, right? Where you're like, wait a minute, no one told us to look under the rock to see what's happening here, right? Where you learn all these things. And again, they're not wrong. And if you have certain diseases, you certainly want to follow an algorithm. It's just not the whole story. And I just remember constantly being blown away. And then, practicing with my patient, constantly being blown away by the results. So what I decided to do, because I come from the land of conventional medicine, is really important for me to structure this so that I can, just make it methodical, because we're from, the scientific mindset. So the new method does that. What we do is we have like a patient journey where you come in and you have certain blood work that is far beyond what's done during a primary care visit. We do saliva testing for adrenal fatigue. And then we actually spend time with our patient, getting to know our patient. Like, we set aside a full hour, which is mind blowing because the annual visit is about 7 minutes.
Mhm.
And not any doctor's fault. It's just the way the system is set up in order to be able to survive. There's no malice here. I just want to make sure that everyone is trying. And then we go over the results, and we use software that tracks not only results but tracks symptoms. Because for a lot of patients, if there's no diagnosis but they have aches and pains, what are you tracking? If their labs are normal, what are you tracking, right? It's one thing if you have a cholesterol and you can track it go down, diabetes, the A1C go down, but what are you tracking on the patient who doesn't feel good, has brain fog or joint pain? You have to track their symptoms. So we use software so we can monitor our progress or monitor flare-ups. And then we work with our patients for an entire year. Like, our patients have to be dedicated for a year, because took you this long to get messed up, it's going to take us more than one visit to, unmess you up.
Mhm.
So it's been a very interesting ride.
Yeah. What do you see in your practice as far as maybe patients before you adopted this new method, how they did versus after you've brought all that in, and or patients who have gone through other doctors who tried everything, and then what happened after they used, your method?
To answer your question, I'm really glad that you mentioned about the patients, because uh, it's also patient dependent. It's one thing to say, hey, I need a doctor that is thinking a certain way. It's really patient dependent, because healthcare still exists and it still has thousands of patients, because certain patients are not ready to make the change. They are either, whatever's going on in life, no judgment, they're not ready to make the change, or they're comfortable with medication, or their lifestyle, the way it is, they want to keep it a certain way, and they're willing to pay the price of having to take medication in order to maintain a lifestyle, right? Like the patient who wants to smoke and wants to be on an inhaler, the patient who wants to eat a lot of carbs and is willing to be on diabetes medication. So those patients still need to be in some sort of conventional medicine setting. The patients who want a different answer, new method and functional medicine is for them. So for those patients, what I see is, I don't want to say the word miraculous because it's not a miracle, but it feels miraculous. It's not a miracle because there's science behind it. But you have patients primarily, over 50 and over, who are just not feeling great. And many of them have resigned to the fact that it's just their age. Or for women, it's just their hormones. They've just been advised it's their hormones. And you just kind of, what are you going to do? Go out to pasture and just, it's supposed to hurt when you go up the stairs. You're supposed to have hot flashes. Absolutely have to have hot flashes. It has to be hormonal, right? And you just kind of live your life. And there's really nothing that, is offered to them outside of, accept it. And their peers are in the same group. So like, why would they think otherwise? So many of them come to me because they're saying, well, the tagline for the new method is because you always knew there was a better way. That's why it's spelled Knew. They always knew the better way. So people come like, I really think there's something else going on with me. It's not just my age. Ever since this happened, I'm feeling this way. And when we change their lifestyle, change their diet, put them on supplements, suddenly, I have one patient that he said to me, within 30 days, he said, I didn't realize how hard it was for me to pick up my wallet when it fell on the floor. I used to groan on the way down to pick up my wallet. And now when I go pick up my wallet, I just do it. And I didn't realize how effortless it is. So
So
it's,
what's the main thing you did for him?
yeah. So
Got him to that place.
it was just a diet change. For him, he wasn't on medication yet. He just really was eating the standard American diet, which is inflammatory. So he was one of those patients who everything's fine. His A1C was fine. He wasn't diabetic. His cholesterol was fine. There's nothing you could do for you. But when we checked his inflammatory markers, they were really high. His CRP was high. His ESR was high. So, but in primary care, what can you do with inflammatory markers? Nothing. There's no medicine for it. And you just say, don't worry about it, or you just don't even test for it. But when we see those markers, we're like, okay, your whole body's on fire. Let's calm it down. With him, it was really as simple as just removing some of the processed food, the refined foods, and getting him some quality supplements, some good omegas, which is amazingly anti-inflammatory, some NAC. And within a month, right? So it's important I'm telling you the month, because it's not just the conversation of weight loss, right? Because the weight loss took time. He was a heavy fellow. So the weight loss took months, but he started feeling better almost immediately because his inflammation went down. So this is someone that if he would have went on some sort of weight loss program that never addressed the inflammation, he would have lost the weight, but he would still be in pain.